Acceptance and commitment therapy is useful for dealing with negative thoughts or thoughts that are affecting an athlete's performance. Some athletes, when they have a negative thought come into the mind, they'll hook onto that thought, then that will start affecting them emotionally, and then that affects their performance, and they can't let go of things. So in ACT therapy, we have metaphors for helping athletes unhook from difficult thoughts. A lot of it is based around metaphors. So for example, your brain's it's a bit like having a personal assistant in your head who's constantly passing you memos all day long. So these are like the thoughts coming in. And some memos you might want to read and think, oh, okay, that's a nice one. But most of the memos are negative. So it's a bit like saying, the memo comes in of a negative thought, and it's like saying, yeah, thanks brain, thanks for that, I'll put that over there. So it's almost like you're seeing the thought and then just letting it go. You might have a nice positive thought come in, saying, actually, you're doing really well today. Oh, thanks brain, thanks for that, I'll put that over there. So it's a bit like saying, right, where are you going to put the memos? Yeah, you're never going to get rid of thoughts. So there's no point fighting against them and trying to get rid of them, because you get the rebound effect. I've talked about it before. It's the white bear phenomena. If you try and not think of a white bear for 30 seconds, you'll end up thinking of one. So in ACT therapy, it's about allowing the thoughts to come in and then just acknowledging them. Okay, thanks brain, thanks for that, I'll put that over there. Your brain's doing a job. It's trying to keep you alive. So it's always looking out for dangers and threats. So some athletes like this metaphor. Other athletes I've worked with like a sushi bar metaphor, where you imagine the thoughts are like sushi dishes on the conveyor belt coming past, and you can look at them and decide which ones you're going to eat and which ones you're just going to let go. These are some unhooking skills, cognitive diffusion we call it in ACT therapy. If you need to know any more, you can check my website out. Links down below.